You sought this video out because you're struggling with round ligament pain. Let me tell you, round ligament pain is usually a pain located on one side of your belly or the other side of your belly. Really common when your baby is growing and your uterus is getting bigger for that ligament to stretch a bit and to cause discomfort. And it can be really uncomfortable on one side of your belly. It can be worse when you're standing, or especially bad when you're going from sitting to standing. And people get really concerned about this pain because it's like close to the belly and you're worried about your pregnancy. But a lot of doctors will just kind of like blow you off and tell you like, oh, that's normal. Like that's just a normal part of pregnancy and you don't have to deal with it. Trust me, there is a solution, and I'm going to give you 3 simple things to do right now that are going to change the game so you don't have to suffer with round ligament pain. The very first thing, it's so simple that you're going to think that where was this in the beginning? And you actually might already be doing this, but maybe just not enough. So the first thing you're going to do is you're going to lift and scoop your belly. Here's what it looks like. As the belly's growing, no matter what size it is, take your hands under the belly and lift up towards your head. This is relieving. This is going to slack the ligament of the round. It's called the round ligament. You're going to slack the round ligament, meaning that you're going to take the stretch off that ligament and just support it. It feels so, so nice. If you have a partner that wants to do this for you, that feels even better. Just have your partner reach their arms around you and lift your belly. It is such a nice relief. Okay, that's the first thing to do. The second thing I'll have you do is to start stretching your hip flexors. So the hip flexors are the little muscles on the front of your hip that create your leg to lift up. So when you start stretching your hip flexors, what this looks like is your leg is going to go behind your body, the other leg goes in front of your body, and you're going to get a nice stretch on this side of your body. If that evokes any pain in the round ligament and it's more than just a stretch, I'll have you just bring your hand underneath your belly and hold the belly as you stretch the front of that hip. It's also a great stretch just to maintain your hip movement as you go through pregnancy, which will help you keep your glutes as you go through pregnancy and recover postpartum. Because we all know about the flat mom butts, right? Okay, well, that's not going to be you if you incorporate this little stretch here. Okay, number 3 that we're going to do that I want you to use after you've been sitting for more than 5 minutes or so, and you can do this also when you're getting out of the car, is when you go from sitting into the standing position, what you're going to do is you're going to just place your hands underneath your belly and then stand up. So you're supporting underneath the belly with both hands as you go from sitting to standing. It looks like this. You're here and you exhale as you're lifting belly up. That's going to take the pressure off of the round ligament, and it's going to allow the round ligament to stretch slowly instead of just having to like rip and stretch right away as you go from sitting to standing. Now, again, most of the people just have this on one side of their body, but it can happen on both sides of the body, and that's why we want to support and slack both sides of the round ligament. So I hope you found this video helpful, and if you did, please like and subscribe to it. Share this with all your pregnant friends because no one should have to deal with round ligament pain. And if you have this pain, it can just be really debilitating, and we don't want you to be debilitated. We want you to enjoy your pregnancy and be ready for delivery, because we already know that your body's going to go through a massive recovery. You're going to be giving it all to the baby, and we have to take care of you so you can feel really good and really prepared and have the energy to take care of a new human, because that ain't easy. Okay, I'm Dr. Allison Feldt. I'll see you next time.